Hello and welcome to Southeastern Health's Healthy Connection radio program. I'm your host, Amanda Crabtree, and today we're going to be discussing arthritis with Dr. Staley Jackson, who provides orthopedic care at Southeastern Multi-Specialty and Urgent Care Whiteville. Welcome to the studio, Dr. Jackson.
Thank you.
If you would let our listeners know a little bit about your background and where you're from and how you ended up providing care here in Whiteville.
Well, I'm a native of Silver Springs, Maryland, which is in the Washington, D.C. metropolitan area. Went to school there at Howard University and further on to American University. And I went to Ohio State University, College of Medicine, for my medical degree. After completing my medical degree, I went to New York City to received my orthopedic training, which I started with the U.S. Public Health Service and finished with the New York Medical College system in Valhalla, New York.
And so you came to Lumberton to practice with Southeastern Orthopedics?
Well, I had a long roundabout trip to get to Lumberton. I left New York City and went to Phoenix, Arizona, and worked for the U.S. Public Health Service Hospital at the Native American Hospital in Phoenix. And from Phoenix, I went to Birmingham, Alabama, and did 2 years of orthopedic service there. And from there, I moved to North Carolina in 1995 and went to a small town called Kings Mountain. They had small hospital there. I was the only orthopedic doctor there, and I loved that little town. I enjoyed working with the people. I enjoyed working with the other doctors that were there. We had really good working relationships, which is very pleasant to work in. And from Kings Mountain, I came to Lumberton, North Carolina. When I first visited Lumberton, I had no idea what Lumberton was like. I was asked to come down one weekend and cover the emergency room, and I arrived on Friday afternoon, and I started covering the emergency room, and I didn't stop until Sunday night covering the emergency room. I was busy that entire weekend, and that's when I said, this is the place for me, because I want to be busy. I want to be working with people, using my skills to help people get better, stay better, and get recovered from their problems. So Lumberton looked like an ideal place for me to settle in. That was in 1995, and I've been there ever since.
Wonderful. And then Southeastern Health decided to open a multi-specialty clinic in Whiteville in September of 2019, and so you're part of that team.
Yes, and so far it's been pleasurable. The people I have had an opportunity to see and talk with were very pleasant. They had some significant orthopedic problems. We had long discussions about their problems. That's the one advantage of starting a new clinic. You have time because your patient load hasn't built up yet. So far I have really enjoyed talking to people extensively about their problems, getting them to understand their problems, getting them to understand what they need to do to help themselves be better and stay better. So far Whiteville has been very pleasant and a good place to be working.
Wonderful. Well, today we're going to talk about arthritis, which is a broad topic and one that is close to you and something that you're quite interested in your daily care that you provide. So let's talk a little bit about what arthritis is for our listeners who may know someone who has it, but they may not have it, or someone who thinks they may have it. What is arthritis?
Well, arthritis really is the destruction of joints. And that destruction begins with destruction of the cartilage in the joints. The ends of our bones are covered with cartilage, and that cartilage is very smooth and very slippery and almost creates no friction when those surfaces are rolled over each other. That's how efficient our joints are. And as long as that cartilage is in good shape, the joints work very well. Usually don't have problems associated with any degenerative processes. But when things happen to that cartilage surface and that surface begins to break down or to be thinned out through friction, we begin to lose that smoothness in our joint flow. And the destruction of that cartilage exposes bone on bone mobility in the joint, and that is very destructive. It's like rubbing two bricks together. Eventually you'll have nothing in your hand but powder. And that is very, very painful, and it causes a lot of destruction in the natural mechanics of the joints. And that's where you get the pain and disability from that cartilage loss. And there's not a great deal you can do with arthritis once it is fully developed and the cartilage and the joints are gone. We have lots and lots of surgical procedures that we use to help people when their cartilage is gone.
So what are some reasons why someone would get arthritis? Is it an injury? Is it overuse? What are some reasons why people develop that? And I know a lot of people have it.
A lot of the time it may be injuries. A lot of young people who are involved in sports, they may get injuries when they're in junior high or high school or college. They are treated, they seem like they get well, and they do fine, but what they may not have realized is that they may have done some damage to the cartilage in the joints that are involved in their injuries. And as they get older, that'll come back to haunt you. Because once you begin destruction of the cartilage, it will be continuous unless you are taking some special care to help avoid that. If you know you have the problem, you can do that. If you don't know, then you just go on with your life as if everything is okay. And all the while, you may be further increasing the damage to the cartilage, and that eventually is going to become painful. And then you have to begin doing a lot of other things to be able to function with the painful joints.
Is arthritis genetic?
There are some situations where degenerative arthritis is not really genetic, but there are other types of arthritis that are a part of our genetic makeup or can be, like rheumatoid arthritis, for example. But degenerative arthritis is mostly from physical injuries or destructions that go on in the joints that are involved. People who do manual work are more likely to develop that problem than people who don't do manual work, simply because they put more pressure on their joints and on their cartilage.
So where is one more susceptible to have arthritis? Do people have arthritis in their hands more, or do you find it in the knees, or is it just anywhere that someone may have had an injury or where that cartilage has worn?
Well, the most likely place for an individual who has just a normal life, the most likely place it will start will be in the knees or in their hands. Now, once we start adding injuries to the picture, people who do manual work, their knees are susceptible, their hips, their back, their hands and shoulders. Those are the joints that will most likely start developing problems because of the stress that is applied to the joints and to the cartilage in the joints.
Can people do too much exercise? I've heard of people who did a lot of maybe jumping as part of their exercise routine when they were younger, and then their their knees are blown. Is that true, or is that just a myth? Or
Most of the time when we're younger, if we're involved with sports, we don't have much control over what specific physical movements we do. We do what's necessary to be involved in the sport. So, there's a lot of running, a lot of jumping. Some sports, a lot of falling, like football, for example. You're always getting knocked down. You're on the ground. You're bumping and running into people all the time. So it's very easy to get joint injuries. They get better. Pain goes away because of the enthusiasm of the kids wanting to play. They'll just continue to go on, only to find out years later that they had some injuries that contributed to the development of arthritis in their knees or their hips or their back or in the shoulders and elbows. People who do manual type work for a living, their knees and hands, and in some cases their backs, are more susceptible because of the things they do all day, every day. And so when we see people and they complain about problems, one of the things we want to know right off is what kind of work do you do? And from that we can get a picture of what their joints may be like when they're complaining about the joints hurting.
Okay, we're going to take a break and come back and dig a little deeper into the topic of arthritis and talk about what types of treatments are available and how can people deal with it on a lifelong basis. And so we'll be back with Dr. Staley Jackson on Southeastern Health's Healthy Connection. Thank you for joining us for Southeastern Health's Healthy Connection. Today we're talking with Dr. Staley Jackson. He provides orthopedic care at Southeastern Multi-Specialty and Urgent Care Whiteville. And today we're talking about the broad topic of arthritis. And so now we're going to talk about what the symptoms are. So you said that sometimes people can be very active and they don't realize they have arthritis until later. And you also mentioned how painful it was. So what are some of the beginning signs or symptoms of arthritis?
Well, the beginning signs are usually pain. Pain in the joints with movement. That's early signs. When we're attempting to do activities that we probably have been doing all our lives and we start to experience pain with those activities, that may be a signal that some arthritis is beginning to develop in the joints. If we know we've had injuries, it's going to happen. The only question is when.
So if someone's had an injury to a joint, you're saying basically you probably will develop arthritis in that joint. Highly likely.
They are much more likely to develop arthritis in that joint than people who haven't had any problems with their joints.
Is there something they can do to minimize that after the injury?
If they are aware or if they know that they have a problem there, they may have to begin to curtail some of the activities they've been involved in, especially activities that put particular stresses on the involved joints. And that way they can help their cartilage out, because you want that cartilage to last you your entire life. And so if you start doing damage to it early on, then you want to help it out so that you won't have a disabling problem developing and could put you out of work a lot earlier than you might want to, or could interfere with other activities that you may want to be involved in.
Are men or women more susceptible to arthritis, or does it go across gender?
Well, in times past, I would say men were most susceptible because of the physical work that they did. But nowadays we have women who are in the whole spectrum of workplaces, and so they can develop these problems just as likely as men are today. One of the problems that may even contribute more towards women developing arthritis is, in a lot of cases, they don't have the muscle bulk for doing heavy manual work, but they want to do it because they have the right to do it and because it pays better, and so they want to get out and get involved the same way men do. And they may be a little more susceptible to developing arthritis because of the strength issue and the type of work they want to do.
So are you saying that because they may not have the muscle, their joints are taking on that?
The joints are taking more stress.
Interesting. Okay. So someone starts to have some pain in their knee or their back. What are the first steps they can do to become diagnosed and determine whether or not it's arthritis or it's something else going on?
Well, the first thing, they should consult a physician. If they haven't had a specific injury, they can begin by taking x-rays of the involved areas to see if they are noticing any signs of cartilage destruction. If they notice any of those signs, they probably ought to be referred to orthopedics, who is a specialist for that kind of injuries, and that way they can be, if they don't need to be taken off of what they're doing, but they can be advised on how to modify their activities. They can be advised on some things that they can do to try to help rehabilitate if they already have developed painful areas. And so it's important that they get to see an orthopedist so they can be advised on how to help their joints last them longer with the problems.
So if you would walk us through the spectrum of treatment, whether or not that's modifying your activity, or are there cortisone shots, or is surgery ever appropriate? If you would start from very conservative treatment for cases that aren't as severe to really severe cases and how those are treated.
Yes, you start out conservatively. Once you get an x-ray view of the involved joints, you can begin with conservative treatment if you don't see mega destruction already. And you can begin to advise people how to modify their activities so that they don't continue to put additional stresses on the involved joints. If you see significant stresses in the joints, then you may be at the point where cortisone shots may be necessary. Orthopedists can recognize evidence of cartilage destruction on x-rays, and at that point they can advise people about anti-inflammatory medications, give that a trial. If that's not doing enough, cortisone injections may be needed. And there are cases where people have gotten beyond the effects of cortisone injections. Now we're looking at surgical correction. Usually by the time you're beyond cortisone injections, the cartilage in your joint is pretty much gone. And your only salvation now is to have a joint replacement. And the technology of joint replacements is so much farther advanced than when I began my orthopedic training. These joints today are very, very good. And I tell people, when I first started orthopedics, I used to tell people, I said, you get a knee replacement, probably lasts you about 10 years, and you need to get another one, because the materials that the new knee is made of only lasted about that long. Nowadays, I tell people, you get a knee replacement today, if you don't go out and do crazy stuff like skiing and mountain climbing, that knee should probably last you the rest of your life if you're just doing normal things. And so the technology now is so much better. And I would recommend that people go ahead with knee replacements if their orthopedic doctor makes that recommendation for them, because I would expect once they get the knee replacement, it's going to last them the rest of their life if they're not doing things that can cause problems with that.
And that knee replacement is an artificial replacement of the cartilage. Is that what
Yes.
happens there? and so you don't have the friction anymore, so you don't have the pain. Is that?
Yeah, and one of the
Okay.
good things about knee replacements now is the part that represents the cartilage. The material there is so much better than it used to be, and it lasts a whole lot longer. And so it's a good procedure to have nowadays, because the pain of arthritis is really hard. When your knees hurt or your hips hurt, it is very difficult to do anything. It's very difficult to want to do anything because the pain is pretty sharp when you feel it. Once the surgery is done and they've
Physical
gone through the
therapy.
post-operative therapy and they get to the point where there's no pain, the first question they ask themselves is, why didn't I do this 10 years ago?
Sure. Okay. Well, we're going to take another break and come back and wrap things up with Dr. Staley Jackson with Southeastern Health's Healthy Connection. Welcome back to Southeastern Health's Healthy Connection. I'm your host, Amanda Crabtree, and today we're talking with Dr. Staley Jackson, who provides orthopedic care at Southeastern Multi-Specialty and Urgent Care Whiteville. Dr. Jackson, is there anything else that you'd like to add to our show topic today?
Well, I wanted to mention the notion of flexibility, and that is maintaining full mobility of all of our joints. That is something that may be associated with arthritis, but doesn't necessarily have to have arthritis. It basically comes from being more inactive than is good for you. As we get older, our activities change, our work changes, the amount of time we spend outside changes, and the ligaments, tendons, and muscles around our joints may tend to lose some of their stretchability. And you may notice that your joints are not bending and straightening fully. They may not hurt, but they may not be bending and straightening fully like they used to. And that's an issue that we have to be aware of, because the more that happens to us, the more sedative we want to become. We begin to enjoy sitting down doing nothing more than we used to. And that allows us to lose our flexibility. Flexibility is important because it allows us to continue to be fully active, which we need to be as we get older to maintain ourselves. We need to be able to be fully active with all mobility in all of our joints. Exercises like walking. Walking is the universal activity, I call it, because that's something that will help our entire body. It helps all of the muscles, all of the joints, and it helps us to deal with flexibility. But other exercises, stretching exercises, are good and important as well. And so no matter how old you are, you want to maintain your flexibility. For younger people getting older, that's an important factor, because that is one of the things that's going to determine how you function as you get older. When you're younger, if you're aware of that and you work on it, then you're less likely to have problems when you're older. But as we get older, we look forward to retirement. We look forward to when we don't have to get up and go to work every day. And one of the evils of that is we spend more time sitting down. And the more time you spend sitting down, the more you're likely to lose your flexibility. And you may find yourself getting little hurts over here, little hurts over there, little hurts when I move this way, little hurts when I move that way. And that may be purely loss of flexibility. So it's important to maintain flexibility, because we should want to be active, be able to get up and go for as long as we are here on this earth. So that's important to keep in mind. Maintain your flexibility. There are all kinds of ways of doing that. We mentioned walking earlier. You know, you can go to the gyms and work on the exercise machines. You can do these things at home. There are all kinds of programs that you can pull up on your TV that have the exercise programs that you can use. But you've got to have a mindset for that. Otherwise, you won't do it.
That's true.
That sounds like some excellent advice for people of all ages. So, Dr. Jackson, we'd like to thank you for joining us in the studio today as part of Southeastern Health's Healthy Connection. If you've heard something today from Dr. Jackson that's piqued your interest, maybe you think you may have arthritis, or you want to prevent arthritis, or you want to find some ways to treat that, you can schedule an appointment with Dr. Jackson at Southeastern Multi-Specialty Urgent Care Whiteville. The number there is 910-207-6514, and they're located at 117 East Main Street in downtown Whiteville. They also provide walk-in primary care and for minor health issues Monday through Friday from 8 to 5 without an appointment. And then Dr. Jackson is there, and also we offer neurosurgery appointments. So again, that number is 910-207-6514. Thank you for joining us for Southeastern Health's Healthy Connection.